let's talk a little bit about feline pancreatitis. What's your opinion on that? The cause, I'm kind of interested in the causality. I mean, we know it occurs. I'm not sure anybody knows what the causality is.
Yeah, I think that's just getting on our radar. I think it's an underdiagnosed disease. It's hard to diagnose, and if you don't have it on your differential diagnosis list, you could probably put it on your differential diagnosis list for most sick. I mean, not a cat who's been inappetent for a day, but most cats that are sick enough, you're getting to the point you're working them up, probably goes on your differential list, and it's flown under the radar for a long time. So it's not easy to diagnose, and plus you're right, we don't know really what causes most cases.
When you have one, when you identify one, how do you treat them? High quality diets, obviously.
Yeah, so they do need food. There's one canine-feline difference, right? So we need to feed the feline pancreatitis patient. Often, though, before we can do that, before the cat is really able to tolerate feeding, they need pain management. This is an acutely painful disease, particularly in the acute presentation versus the chronic. But so they need pain management. And they do need to be appropriately fed. They need to be appropriately hydrated, right? So we have to address their supportive care issues, but sooner rather than later, think about getting food into those cats.
I think that's one of the most difficult cases we see on a regular basis. It's mostly old cats and it
older,
seems like older, middle-aged to older, and I don't know how much inflammatory bowel plays in that. But I mean, we talk about this triaditis component, and that's hepatitis and pancreatitis and that sort of thing. I mean, prednisone helps, or some relative of prednisones.
Sure, I agree with you, and I think probably more often than not, pancreatitis isn't a disease in isolation in the cat. There's probably some degree of involvement, minor versus major, of the liver and the duodenum as well, and it's usually if you have 3 organs involved, it's probably an inflammatory disease. So that's where our prednisone comes in.
And tough to treat because you got to try to get medication down these cats long term.
Yeah, long term.
Now they have, they obviously have long lasting steroids. Now a really nice long lasting antibiotic and some of those sorts of things. And I don't know how this all is going to play out, but I wouldn't be surprised if they play a part in that.
Yeah, I agree.